Thanks for inviting me. I think this is actually very timely. And I'll tell you why it's kind of interesting. Yesterday, and I don't know if they did this just because they knew I was giving this talk today, but one of our major societies, American Society of Breast Surgery, set out a survey to ask this specific question. So I think this is very timely, and I think it's made a big difference. My key thing here is ERIS is not for abdominal surgery only anymore. So we in breast surgery have taken this and embraced this. And I want to give a special thanks before I start this talk to Dr. Christine Yoger. She's one of our residents who did a lot of work on this, who gathered a lot of the data and continues to do more work with us. So this is just a start of some of our research to kind of get this going. I'd like to thank Dr. Ryan Craner, who gave me a lot of information on the anesthesia part. I won't not bore you, but I won't add this into this talk because I think we've covered this very nicely. And then my surgical oncology colleagues and plastic surgery colleagues who, once we decided to start this, really embraced the change. And of course, I'd like to thank Dr. Tonya Young-Fadak, who started making us all very on the ERIS bandwagon. So I think that's quite good. Well, as we know, what started this, and it was started by accident. So I got some edict from somewhere, and I don't know, and I kind of listened to what I'm told, that we have to change, and we have long hospitalizations for mastectomies, and we have to do outpatient mastectomies. So I took outpatient mastectomy as same-day discharge. That's not what they were talking about. Most mastectomies are done, they stay overnight, and then they're discharged the next day. So I misunderstood what happened, but in actuality, it was a blessing. So we got this edict, and we said, well, we could do ERIS too, and we started this protocol in 2017. And as you know, with all ERIS protocols, there are three parts: the pre-op, the intra-op, and the post-op. So first, in the pre-op, you have to change a patient's mindset, or everybody's mindset. Most patients had their friends who've had mastectomies, they're all admitted, but you have to tell them, no, we're not admitting you anymore. You're going to go home the same day. Our patients can do it. It's very easy. You'll find that your pain's well controlled. We have no more complications. We will check on you in the PACU to make sure everything's A-okay. And once you tell them that, and you kind of counsel them pre-op, it makes all this easier. The second thing is intra-op. Along with all the good things that anesthesia